Welcome back to Catalysts in Conversation, presented by the National Association of School Psychologists. I'm NASP President Peter Faustino. In the first few episodes of this podcast, we've been able to explore issues that directly impact the work of school psychologists, from policy battles surrounding social emotional learning to how schools can support young people experiencing challenges related to their mental health. Today, I am so excited to discuss another topic that is incredibly important for school psychologists in our efforts to serve youth, families, and schools. That is suicide risk and prevention among youth with neurodevelopmental disorders. Today, I'm excited to explore this topic with Dr. Paul Lipkin, a neurodevelopmental pediatrician at Kennedy Krieger Institute and a professor of pediatrics at the Johns Hopkins University School of Medicine. Dr. Lipkin has provided national leadership on children and special healthcare needs and disabilities, including autism spectrum disorder and other neurodevelopmental disorders, through his work with the American Academy of Pediatrics, or AAP, where he's served as chair of its Council on Children with Disabilities. He remains active in key AAP initiatives that directly impact the work of school psychologists. These include their guidelines on developmental and ASD screening and on the implementation of the Individuals with Disabilities Education Act, or IDEA. Dr. Lipkin, thank you so much for being with us today.
It's a pleasure to be here. Thank you for inviting me.
My pleasure. I understand that you are currently researching the risk and prevention of suicide in children with neurodevelopmental disorders, and that includes autism spectrum disorders. I myself have worked with children and families living with autism. I've done this work for about 30 years. And as much as I have read the research and done some of this work, I only recently learned about the higher risks for individuals on the spectrum. Can you start by telling us what you and others saw that sort of precipitated this research?
Yeah, thank you for asking. So I myself also had some light bulb moments. Um, as you've heard, I'm not a psychologist. I'm not a psychiatrist. So how did I get into the area of suicide, which typically have been their domain? Well, I've been delivering care to children with autism and other developmental disabilities, intellectual disabilities, learning disabilities, ADHD for my entire career over decades. And I had the opportunity and pleasure to direct the Interactive Autism Network for nearly 6 years, which was an online research registry for children with autism. Well, it was during that, and I was devoting myself very specifically to um, gaining new knowledge and information around autism, which is what our mission was. And we gained that information from the people who were living it every day, from parents and children. And I had a interaction with a parent of a young girl, a teenage girl with autism, who by every measurement was doing really well. She was apparently nonverbal when she was a preschooler. She started early intervention at proper ages. She got her way into a mainstream learning environment, and was really succeeded. Her learning levels were within the typical range of learning. But when she became a teenager, she developed this perseverative thinking around wanting to die and wanting to harm herself. And that really, and I knew this family well. These were very well-educated people with lots of resources at their disposal, including professional resources. They lived in the city, in the Baltimore metropolitan area, where we have terrific medical centers and medical professionals. And despite all this, they really struggled to get the help for their daughter. Um, and I actually had never been interested in suicide before, but what impressed me was that this girl, and as I was learning through other professionals, many children with autism have been struggling around issues of suicidal thoughts and ideation. And my impression was that there's something different about it in these children than what I'll call typical suicidal thinking and behaviors that are so common widely known about and researched in teens and young adults, because the children with autism and related disabilities often have problems with language understanding, have problems with expressing their thoughts, have problems engaging with other people, are often isolated, sometimes by choice, but sometimes by the choice of others, and they're subject to bullying. And as a medical professional, I also had this feeling that as we were learning more and more, there were really clear biological underpinnings to autism. That I was feeling like there might be a neurologic explanation for this. And so
Yeah,
that's when I really started to take a deep dive on autism, connecting autism and suicide, excuse me,
yeah.
connecting with other people in the field from all over the world who were focusing on this area. Um, and ever since then, I've been devoted to to these issues, and to trying to tackle them. We have so much to learn and so much to do, and there's so little known about it. So, uh, I'm sorry if I'm getting long-winded here. Um,
No, not at all. Actually, I
um,
was about to say we're indebted to you for this work. So
okay, good.
please, it's important.
So, what most importantly is because of this budding interest, I had a fantastic research tool at my disposal called the Interactive Autism Network, and a really a great dedicated staff and support system. And so we created a survey for families to get a sense from them as to how common this issue was. Um, and we sent out a survey for people to volunteer to complete. In 2016, I believe, and nearly 1,000 families completed this. Um, it took us a while to get the information published, but it is published in the JAMA Pediatrics 2023, the key findings. And what I think was most important and has driven me ever since was not only that there were high rates of suicidal thoughts and behaviors amongst these children and teens with autism, but we asked a critical question, which was when did your child start feeling as if they no longer wanted to live or wanted to harm themselves?
Mm.
And and it turns out the most common, uh, excuse me, a step back, is these were parents of children between ages 8 and 18. Okay,
Okay.
and most common age when children were first reporting suicidal thoughts and thoughts of not wanting to live any longer was below age 8. So between ages 5 and 8. So that really said to me, there is something really different and important here that we really need to understand. And so I do, for those who are interested, I do recommend you looking at our results because they were really revealing. And ever since then, um, I've been working on efforts at suicide prevention, identification and prevention, in specifically in the population of children with developmental disabilities.
Dr. Lipkin, I feel like part of when I do these podcasts, I'm always interested in these like origin stories, like these moments in our history. And I think you just described it about one family, one transformative moment that really led to the research and the findings that we have today. The next question I wanted to ask is, when children and teens come into school psychologists' offices and the kids are depressed or dysregulated, I think professionals are very quick to think about suicide. For young people with ASD, and you said it can even start as young as 8 years old or younger, we don't often think about that or recognize the risk that exists. Are there other key findings to the research that you could share that, what should school psychologists sort of know about this intersection between autism and suicide risk or even suicide prevention?
Yeah, a great question. Um, so we again, we know that it occur in all ages. We also know uh, in the field that children with autism are at high risk for mental health problems.
Right.
We are familiar with anxiety disorders that many of have. We're familiar with ADHD, but we never sort of put two and two together as to the fact that this may make them at high risk for self harm.
Mhm.
And again, as a medical professional, I'm dedicated to making sure children don't injure themselves and certainly don't die. And so that's sort of what's kept me going. And I think that it's that we need to really think about how we can really protect these children,
Mm.
and certainly those with other mental health conditions, and especially those with anxiety disorders and obsessive compulsive disorders, are really a very high risk for this suicidal thinking and behavior. Um, and um, and also, as we were talking about, children with autism are not talkers. They don't necessarily tell you what they're thinking, they even know how to express these thoughts. So sometimes you just may need to ask them a simple leading question, and find out things uh, that you um, hadn't been aware of before. It might reveal some major worries or concerns. And so for school psychologists, when they're seeing the children, they are always thinking about ADHD because it complicates the learning. They might be thinking about anxiety as well, but they also need to think about whether there some sort of inner turmoil that these children may be having an experience, uh,
Yeah.
maybe having and experiencing, and certainly can be set up for if they are um, being bullied and so on. I think these are the children that one needs to pay really close attention to.
Yeah. When we do our updates in schools around suicide assessments, I know the big takeaway, the key takeaway for faculty and staff is often that just because you talk about suicide or introduce the topic or ask a question about suicide does not mean that you are planting ideas. In fact, the opposite. You are just gaining access to what those thoughts are. And I think you said something really important just there around for years, I feel like people would talk about autism and then lump all these symptoms under the diagnosis, under the umbrella of autism, saying, well, they have inattention, that's their autism. They have, OCD symptoms, that's their autism. And in fact, what I've been reading a lot about is that we've got to start looking this as comorbid conditions, that they have autism and OCD, autism and ADHD, autism and are at risk for suicide, because it just changes the framework in which I think we're going to be able to treat individuals that are, experiencing these different conditions.
Yes, yes, and what I failed to say is important in this context is that you know all the research that we've been working on is in verbal children.
Mm.
Okay, children who can express their thoughts and feelings, uh, um, um, and um, and can understand spoken language. And but we know even less. We only know a little bit, but we know even less about those children who are less verbally competent as well. And I think there's so much stigma around suicide,
Mm.
and I will tell you that people are afraid of it. And to me, as a medical professional, reminds me of cancer. You know, you should never, in prior generations, you never mention the word cancer. It's a terrible thing. You want to avoid it at all term. You wouldn't even tell people they have cancer. And we right now are in a mental health uh, period
Crisis.
of time, epic, when we are still trying to overcome the stigma of mental health issues,
Yeah.
and so uh, many professionals, certainly in my sphere, which is in the healthcare environment, are afraid to venture into it, to talk about it, to think about it. But also our mental health professionals, including our psychologists, sometimes are really, they're really uncomfortable with it.
Yeah.
But this is, if they're really worried and concerned about the well-being of the child, then you also have to recognize the fact that it's not only the child's mental well-being that's at risk here, but also their physical well-being as
Yeah.
well.
Yeah. Yeah. The very thing that we have to talk about could save lives, and we have to remember that for
That's
sure.
right.
Thank you also for mentioning sort of the more profound autism and intellectual disabilities that are connected to autism that we don't shed enough light on, and on some level the thought that they are suffering as well, but maybe just can't quite communicate it in the way that we're gaining access to at this moment. Yeah, I mean, I feel like school psychologists, and you said it, I mean, they're on the front lines along with pediatricians and other medical professionals around this youth mental health crisis right now. And we see it. We see it every day, how it's impacting children and their families. Would you offer any recommendations for how we incorporate all this understanding into suicide risk for children with ASD? Really, almost like in our day-to-day work with students and families. What are things that we should remember, things that we should do, advice that you would give?
I think, I think people in the school system and certainly school psychologists have an opportunity that other professionals do not. The schools where the child spends most of their daytime hours, most of their waking hours, and it's with familiar people. People who are almost as familiar as their own parents and their own siblings, and so that creates a setting where one has a chance to recognize problems that a child is having. What the best method to do that is sort of uncertain. So, mm, um, my current research is looking at screening in medical settings, and what it turns out that children will share their suicidal thoughts with a medical professional who they don't know, who they haven't seen, to who they're a bit anonymous when they won't with their own families. And so in the schools, I think the teacher, classmates, the guidance counselors are so familiar to them that a student might not want to share these kind of thoughts with them. But the
Yeah.
school psychologist may step in less frequently, and may not and may have an opportunity to find ways of exploring this with a child that she or he wouldn't open up to with other professionals. What the best means to do that is, I don't know. In medicine, we now have a 4-question screening tool called the Ask Suicide Screening Questions, or the Ask, that's been designed for use in a professional setting. But there are other things akin to that that can be implemented in schools um, in certain scenarios. And I don't think anyone knows the best practices and the best way to do this. So there are real opportunities here for school systems um, to um, to look at this issue, to address this issue, and to try some things and be not just innovative, but really do some really important work. We all know about issues of handgun violence in schools, and schools had a uh, unexpectedly, had to find ways of dealing with it, until to this day struggle with that. Um, and I think in terms of suicide, identifying suicide risk in schools is at the beginning as well. And I think school districts, if you have really dedicated professionals who feel this is really important, and I'd be happy to to tell people why I feel it's so important. But if you have some people committed to it, then you can really uh, try some really good, important things that inevitably are going to be helpful. Nobody knows what the best thing is to do, but we know that doing nothing is not helpful.
Yeah.
Doing something and doing anything, I think at this point will be good in identifying children at risk and finding some means to get them the help they need before they get themselves in harm's way.
Yeah, yeah, early identification. And I almost think the answer is in the name of that screener, right? It's like just ask, right? Just
Exactly.
start the conversation, ask. I mean, school psychologists are, I think at the core, we are about data, using data and assessment in our work. Happy to give you another minute to tell us more about that ask for question screener that you're using. I think the listeners would be interested in, is there anything in there that you think is the core to what we need to get at?
Yeah, so the ask was developed by Lisa Horowitz and other key researchers, all working at the National Institutes of Mental Health.
Okay.
And their intent was to find a screening test that was good in medical settings. And that's because there was some data showing that children who attempted suicide had been seen by a doctor within weeks or months for a visit. And when they came in for the visit, they came in for something else. And so it was first being implemented in emergency rooms. Now, I will say, and then later in some other medical settings, they were designed for typical children. And so there are four questions with a fifth one if a child shows any signs of suicidal thoughts afterwards. Um, but they are written for children with typical development. And the language may not be appropriate for children whose language understanding and language use is not as good. So there's question like, have you recently been having thoughts about harming yourself? Okay, well, those are sophisticated words. What's recent and what's harm? Okay, do you wish you were no longer alive? We're dealing with the whole concept of life and death with children. We don't know really what they believe. So
Yeah.
we've been using that screener because it's really been the best one around, from in my opinion, for medical settings.
Yeah.
It's four questions, and if you have a yes on any of these, then ask the fifth question, which is, are you having thoughts right now of harming yourself?
Yeah.
That's the acuity question, in which case then you have to implement. That's an emergency essentially, and you need to implement
Yeah.
something to get that child help immediately.
Ye-
And so that's the ask. What we are working on at the Kennedy Krieger Institute, in concert with the people at NIMH and Nationwide Children's Hospital is now involved with us as well, is we are looking at the ask in our population of children: autism, ADHD, learning disabilities, intellectual disabilities, all verbal children, though, between the ages of 8 and 18, asking them those questions. And we've designed some new questions that the people at NIMH actually have designed some new questions with simpler language, and we're
Okay.
testing those out at the same time. We
Yeah.
have just finished recruiting all our subjects. We have about 280 children, and who we asked the ask and these new questions, and hopefully in 2025 you'll start seeing the results of this project, and with publication in 2025 or 2026, because we think um, it's important that professionals treating children, whether it be medical professionals, educational professionals, mental health professionals, may need to use a different tool than they've been using before.
Yeah.
Um, and so I would stay tuned on that.
Yeah, well, and based on what you just said, it sounds like school psychologists could use a screener or tool like that in an educational setting. It's not specific to, I think, a medical office. And I need to highlight what you said about that part of individuals were coming in for other reasons, but really at the core wanted to talk about that. And I think you just described the experience that happens for school psychologists on a weekly basis is students will show up talking about something, but maybe really want you to ask about this other thing that they want help with.
That's right. And we had to train our own staff to start asking these questions. They felt really uncomfortable with it. Um, um, but um, but while and staff was uncomfortable and parents were uncomfortable having their child ask these questions in the
Mm,
beginning. And But interestingly, I think what we've seen is the way children will open up in a way that was unexpected. And so our staff has really become very convinced of its importance and its utility.
yeah,
Parents, um, while some of them are still a little bit uncomfortable because they still worry about your putting an idea in a child's head,
right,
which, as you
right,
said, is not true.
right.
Um, they're just trying to be protective of their child, and they probably underestimate their child's ability to understand things.
Yeah,
In our most recent publication, which just came out this week, we have findings on 10,000 children screened at the Kennedy Krieger Institute, and that people might be interested in. But Interestingly, when you compare the children to the parents, the children generally had no concerns about answering these questions.
right,
These are children who walk into schools with metal detectors. They hear about children being harmed. They hear about suicide. It's in the popular media. They hear about people harming themselves. They're not afraid of these questions. They're
Right.
open to it.
Right.
Parents are maybe a little bit overprotective. So I think the school psychologist does have an opportunity, and each person develops their own particular style
Yeah.
about this. But
Yeah.
but you could just say, "Have you been thinking about hurting yourself, or do you wish you were no longer around?" It's these are easy questions to ask once you've done it a couple of times,
And
I'm always surprised when we get the yeses.
yeah. And I was just going to say that in my experience, when you ask that question, it's very it's very cut and dry. It's no, no, I have not thought about that. And then sort of you can go in a different direction. And when you get a yes, it really is a doorway, a window into, I think, those conversations. And children, I find, are very honest. They're struggling with these thoughts or these behaviors for quite some time. So they want someone to ask. They want to share the burden or the load.
Yeah, I can share some numbers from our paper that just came out, and later I can tell you how people can find it. But
Yeah, well, we would definitely like to link to all of the resources that you're talking about, tied to the
okay,
podcast. We'll make sure that we do that.
yeah.
And I'm happy to
I
hear
can
those
also share the
numbers.
numbers for
Yeah.
people. So again, we screened almost 10,000 children in our medical clinic. So children coming in not for primary care, but for specialty medical care, neurologic developmental care. 8% of children screened positive. So that's not a small number.
Hmm.
When you go to our mental health clinics, it was 12%.
Wow.
Again, and then in our autism program, where they deliver a lot of mental health care, again, 12.5% of children. So these are not small numbers. We're not talking about one or two children once in a while. These are frequent occurrences in multiple clinics. And so I think the school psychologists really do have opportunities here to
Yeah.
really help children and prevent them from harming themselves.
Yeah. So this is such an exciting conversation to get access to this research. Where do you see the research going from here? I shared with you earlier, I've been doing this work with families for 30 years. I remember when I started, we didn't have good information. We were still sadly using terms like childhood schizophrenia or refrigerator mother, and we've done, I mean, really such we've covered such ground. We've done such better work in that time. What's next, and how do we continue to serve children, and how our school psychologists maybe could be a part of some of that?
So there's active research right now going on in suicide safety planning.
Okay.
Okay. That is something that I'm involved with, but a little bit more peripherally, because that becomes the responsibility of the psychologist and psychiatrist. So, what
Right.
do you do when the child does express some suicidal thoughts and behaviors? There are different types of safety plans that are out there. There are some now that are specifically being designed for children on the autism spectrum, again, because the language is different. Um, and and uh, these safety plans are really low tech,
Yeah.
uh, and but they're really amazing tools that have got to be doing some good. And we need to, people are going to keep working on those and trying to prove their benefits and trying to see how we can improve upon those. So
Yeah.
that's really important.
That's great.
Is safety planning. So what do you do when you find a child? Um,
Right.
is therapy the best or medications the best? We don't really know that. But this low tech intervention may be as powerful as all these other things.
Yeah. As we're figuring it out.
And there's a lot of research going on um, in in the UK and in Australia on young adults with autism and suicidality because they
Mm.
are confronted with different kinds of issues and problems related to employment, related to interpersonal relationships,
Yeah.
but also tied to their own um, disabilities as well.
Yeah.
And so that is um, really important research overall. For those psychologists who are working with adolescents, that might be really particularly fruitful. For
Yeah.
me, as a pediatrician, I am most interested in those young children. And the NIMH now is just starting to fund projects focusing on preteen youth. Okay, so we're talking about children ages 8 to 12. Typically, I'd like to see it go down to age 5. So what are the roots and the foundations for these children? Those children probably um, are the rates of death by suicide in those groups are small.
Mm,
Doesn't mean that they're not at higher risk for later
right.
suicidal thoughts.
Right.
And even if their rates of death are small, the rates of injury can be significant.
Yeah.
One of my colleagues in arms on this, Dr. Suzanne Ripchinsky, is a general pediatrician hospitalist. She became interested because she was taking care of children um, who had brain injury as a
Mm,
result of suicide attempts, young children. So I think we really need to understand it better in young children as to its nature and as to what we could do to identify it and to intervene early.
yeah. And trying to understand those core constructs of what's leading to this. And as you
Right.
said, especially if left untreated, the longitudinal, the longer outcomes, I think are really significant. So, um, you were just, I think, getting to my next question around this work can be really hard. This topic in particular, as you said, there's still quite a bit of stigma around it. Sometimes people have personal experiences that just aid in the struggle around this topic. One of the questions I ask all of my guests is, how do you professionally and or personally prevent burnout? I think a lot of our school psychologists are working in really tough conditions. They wish the ratios were better. They wish they had more time to do and engage in some of this work or change the systems. How do you find joy in your moments of difficulty, or what do you do to combat sort of burnout? I can tell you're very passionate about this work.
Yeah. So, we ourselves have had to work a lot with staff in terms of explaining what we know about it and explaining its importance. And I think, and I think certainly school psychology staff, but even teachers, I think, can be convinced of how important this is in terms of helping a child and making their life um, um, as safe as possible. And so I think we need to destigmatize it all.
Yeah.
I think people do have their own personal experiences sometimes, and um, my mantra is it's not okay to do nothing. And I just so I think some professionals will uh, uh, be all in and jump right into it, and others are going to be a little bit more ginger. I think both are okay. I'm obviously all in, and
Yeah.
I sort of have I lead a lot of efforts because of that. But
Yeah.
I also respect those who are really uncomfortable with it. But I just want them to do something,
Yeah.
and so teach them to ask a couple questions. Have them become tuned into the issue, and so professional burnout is a problem not just in the world of psychology and education, but in the medical world as well. You might not know this, but the rates of people going to pediatrics the past couple of years has been decreasing. People are not looking. People are not interested in the challenges that they're being confronted with. Um, and so we really have to be conscious of burnout.
Yeah.
Um, and so I think in asking people to take this on, we have to be respectful of of how comfortable they feel and how much they could do. But like anything else, I think educating them will hopefully bring them on to better understand, to intellectualize it in their own mind as to why this is important and to not fear it. And then just to do that one or two things that's going to
Yeah.
make a little bit
Yeah.
of difference. To me, it really has enriched my career, uh, um, and um, and it's a mission that I'm very much dedicated to at this point. And I think other people, once they sort of lose the fear of it and think of it as somebody else's problem, once they realize this is everybody's problem and that you can play a critical role, I think people can really show willingness to take it on. I also would direct people to the American Foundation for Suicide Prevention, the AFSP. Great
Mhm.
organization, leading a lot of these efforts, have lots
Yeah.
of resources available as well.
Yeah. Yeah, that's a terrific resource. I agree. I was struck by what you were just saying now, and maybe even earlier around the idea that some of this can be done efficiently if you know more, and that these are low tech interventions, right? That ultimately save a life. And I don't know about anything greater in sort of filling my cup in the work that I do than to be able to, share with somebody when they say, "How was your day?" And you say, "I saved a life today," right? I mean, that
Right.
would keep me motivated and energized, and maybe push some of that burnout to the side. We do get stuck in the minutia of paperwork and meetings and just lots of other things, but to be able to walk away and say, "I saved a life today," has to be one of the greatest things we can do in our parallel professions.
Yeah, there's no doubt that when you find a child like this, your day's a mess. There's no doubt about that.
Very
Uh,
true. Very true. Yeah.
and but on the other hand, I think at the end of it, you realize the important work that you've done and how important it is for that particular child. If you hadn't uncovered that, if it hadn't been apparent, what would have been the consequence of that? And so uh, did your lack of action contribute in some way?
That's
Yeah,
a very powerful thought.
yeah.
Dr. Lipkin, I think we've got time for maybe just one more question. I mean, we've covered such wonderful ground, such great information. You gave us some resources that we're going to share with our membership and with those listeners here today who are not only school psychologists, I think, but just people who love and care for individuals on the spectrum. But any parting advice? I mean, school psychologists work really hard to be trusted adults in the lives of children. And I'll offer you sort of the last word as to any advice and how maybe we could just do better with this population specifically.
Um, well, I like the way you were describing the school psychologists. Um, um, they are um, they are trusted. They are trusted by the children that they see. They're trusted by the professionals. They're advising the professionals. And when they're engaged with parents, the parents are counting on them for their help and advice. And so I think um, uh, they really are at the front lines being in the schools. But school psychology used to be, administering standardized tests, and there's still a lot of that. But here's an opportunity to do so much more than that, without um, any extreme any extreme efforts. And so I think school psychologists can play a pivotal role on helping these children, identifying them early on. And, especially they understand better than anybody the nuances of children with developmental disabilities and the difficulties that these children have. And so they, again, can often be at the center of helping these children, the families, and the school system um, uh, work to prevent these children from coming in harm's way.
That was beautifully said. And thank you on behalf of school psychologists who are listening.
My
Dr.
pleasure.
Lipkin, thank you so much for this interview.
Okay, you're welcome.
Thank you again to Paul Lipkin for this incredible, truly life saving conversation. I hope that school psychologists listening to this conversation will come away with a sense of empowerment and an understanding of the ways that they can support young people with autism spectrum disorders and ensure their safety. That way, we can take this conversation and put it into action. This has been Catalyst in Conversation. I hope you've enjoyed hearing these insightful dialogues with my guests as much as I've enjoyed speaking with them about these critical issues. I'm Peter Faustino. Thank you for listening.